When you reach your golden years, health becomes one of the most precious treasures you can ever protect. Seniors visit doctors more often than any other age group. They depend on them for advice, guidance, and sometimes life-saving treatment. But here's a truth many people don't realize. Not all doctors give good advice. In fact, sometimes doctors say things that reveal warning signs, red flags that you should never ignore. In this video, we'll uncover 5 shocking things doctors may say that should make seniors think twice and even consider walking away immediately. Because at this stage of life, choosing the right doctor can mean the difference between living longer, stronger, and healthier, or suffering silently from neglect and poor medical care. Why this video matters for seniors. As we age, our bodies change. Medications affect us differently, chronic conditions become more common, and our healthcare needs become more complex. That means seniors need doctors who truly listen, who take time and who see the whole picture, not just the quick symptoms in front of them. Sadly, many older adults feel ignored, dismissed, or even rushed out of appointments. If you've ever left your doctor's office feeling unheard or brushed off, you're not alone. And that's why it's so important to recognize when a doctor's words are actually warning signs. Now let's dive into the 5 things doctors might say that should set off alarm bells. Red flag number 1. That's just part of getting older. Imagine you go to your doctor and say, "Doctor, I've been feeling unusually tired," or "I've lost weight without trying," or "I keep forgetting things more often." And instead of investigating, the doctor shrugs and says, "Well, that's just what happens when you get old." This is one of the most dangerous things a doctor can say to a senior. Yes, aging brings changes, but many health problems that appear in older adults, fatigue, memory loss, weight changes, pain, are not always normal aging. They could be signs of heart disease, diabetes, thyroid problems, vitamin deficiencies, even early dementia or Alzheimer's. When a doctor dismisses your symptoms as just aging, they may be ignoring serious treatable conditions. A good doctor will never brush you off with that line. Instead, they will run tests, ask follow-up questions, and make sure they are ruling out any possible health issues before deciding it's normal aging. If you hear this phrase too often, it's time to seek a second opinion. Red flag number 2, it's all in your head. This is another red flag that seniors need to take seriously. If you're experiencing pain, dizziness, confusion, or strange new symptoms and your doctor says, "It's all in your head," or "You're just being anxious," that's a problem. Your body knows when something is wrong. While anxiety and depression can affect health, dismissing real symptoms without checking them properly is dangerous. For seniors, this can mean missing early detection of cancer, heart conditions, stroke risks, autoimmune disorders. Sadly, some doctors fall into this trap, especially with older patients, assuming they're just being overly worried. But ignoring symptoms can allow small problems to become deadly. A caring doctor will never make you feel like a burden. They will take your concerns seriously and work with you to find answers. Red flag number 3, you don't need to know the details. This one is subtle but just as dangerous. Some doctors believe patients, especially seniors, don't need to understand their own treatment plans. They may say things like, "Just take this pill, don't worry about it. You don't need to know all the details." Or, "Trust me, I know what's best." Now, trust is important in medicine, but blind trust without explanation is risky. Seniors are often prescribed multiple medications at once, sometimes 5, 10, or even more daily. Without understanding why you're taking each pill, you could end up with dangerous drug interactions, take the wrong dosage, or suffer side effects that go unnoticed. A good doctor explains things clearly. They will break down your diagnosis in simple words, tell you what each medication does, and give you space to ask questions. If your doctor doesn't explain and expects blind obedience, it may be time to walk away, because your health is your responsibility and you deserve to be fully informed. Red flag number 4. There's nothing more we can do. This phrase has crushed the hopes of many seniors. Imagine being told there's nothing more we can do for you. For some patients, it feels like a death sentence. But here's the truth. In most cases, there are always options. Yes, some diseases are advanced and difficult. But nothing more we can do often means the doctor has given up. Not that all medicine has. If one treatment fails, there may be alternative therapies. If medication doesn't work, lifestyle changes could help. If pain persists, pain management specialists might offer relief. If your doctor isn't familiar with advanced treatments, another specialist may be. The field of medicine is evolving every day. What one doctor calls the end of the road could simply mean they don't have the knowledge or resources to go further. Seniors deserve doctors who fight for them, who keep looking for answers, and who don't give up easily. If your doctor says there's nothing more we can do, consider getting a second opinion before giving up hope. Red flag number 5. At your age, it doesn't matter. This is perhaps the most heartbreaking phrase of all. Some seniors are told not to bother with certain treatments, tests, or surgeries because they're too old. Yes, age is a factor in medicine, but health decisions should be based on your overall condition, your wishes, and your quality of life. Not just your birth date. A healthy 75-year-old may do very well with surgery and live many more active years. An 80-year-old who eats well, exercises, and has no major conditions may benefit from aggressive treatment for heart problems or cancer. But if a doctor says, at your age, it doesn't matter, they're stripping away your right to fight for your health. The truth is, it always matters, because every senior deserves the best possible quality of life for as long as they live. How to protect yourself as a senior patient. Now that you know the 5 red flags, what can you do to protect yourself? 1. Always ask questions. Don't leave the office until you understand your condition and treatment plan. 2. Bring a notebook or a loved one sometimes. 2 ears are better than 1. Write things down so you don't forget. 3. Seek a second opinion. If something feels wrong or dismissive, don't hesitate to ask another doctor. 4. Know your rights. You have the right to respectful, thorough medical care no matter your age. 5. Choose doctors who listen. A great doctor isn't just skilled, they're compassionate, patient, and willing to explain. Doctors hold great power in shaping your health, but as a senior, you are not powerless. You have the right to demand, respect answers, and the best care possible. If you ever hear your doctor say, that's just part of getting older, it's all in your head. You don't need to know the details. There's nothing more we can do. Or at your age, it doesn't matter. These are warning signs that you may need to walk away. Your health is your most valuable asset. Don't settle for a doctor who dismisses you. Find one who listens, explains, and truly cares about your well-being. Because remember, living longer isn't just about adding years to your life. It's about adding life to your years. If you found this video helpful, don't forget to like, share, and subscribe for more health tips to keep your body strong and healthy after 60.